presentation is really about, what happens when you have a claims denial or insurance company decides to drop you. You can actually appeal that. So if a health insurer goes about, denying a claim or denies your coverage, you have a right to appeal that decision. A claim is a request for coverage. So you and your healthcare provider can file a claim to get reimbursement from the insurer for the cost and treatment of services. And, one of the things I try to explain to people, I've been doing this, for probably 19 years now. I've worked for a major healthcare carrier. I've been on the consulting side for health and wellness benefits for employees. And one of the things I tend to come across is, I really don't understand my benefits because I don't understand the wording in it. And so, we try to, give you information like glossaries and things like that. It really is hard to determine where to go to attain your documents so you can file an appeal. One of the things that you should be familiar with is a summary plan description. That is basically the contract for a self-funded employer plan or a individual plan. And if you have a certificate of coverage, that means that the insurance coverage is part of a fully insured plan. And so they're the same thing. They're just really just planned contracts, but one is called a summary plan description and one's a certificate of coverage. Then you have your schedule of benefits and your benefit summaries. That gives you a snapshot of what your plan design looks like. So, what your office visits are, what your hospital co-pays are, and what does surgery cost, and what are your drug co-pays and things like that. And then you have your explanation of benefits that actually, Lou just went through earlier, and on there is reason codes. And so when you have a denial or a cancellation of coverage, there's usually a reason code on the explanation of benefits, and that's going to be key and knowing how to go about, appealing a claims denial. Some of the reasons, you might encounter a claims denial is the service of the procedure is excluded, it's not medically necessary. You'll probably hear more often than not, is it medically necessary? And, while people feel that they're entitled to have everything covered, unfortunately, the contracts only cover like this much and people expect this much, right? So, we want to just make sure that there are it's evidence-based, FDA approved procedures, and they're not experimental procedures, whereas sometimes in a contract, you can have an experimental procedure covered, and that's usually in the contract language, and you have very specific criteria to meet for consideration of coverage. We'll get into that in a little bit. Your claim could be missing information or has incorrect information. So, we kind of call that like, we have a clean claim, which means everything's on there is correct, versus a claim that's missing critical information, like maybe your ID, and something as simple as your date of birth missing could actually deny coverage for you. But usually those things can be fixed when you call your provider's office, or if you call the insurance carrier. They will usually tell you what the reason is if it's not on your explanation of benefits, and you can usually work that out before you have to actually file an appeal. An appeal is really like a last resort before you have to, you kind of try to seek some advocacy, like from somebody from like me or somebody from the Pulse of New York, to walk you through the benefits. Another reason why claims might deny is an exhaustion of benefits. You might have a chronic condition, and your policy or insurance policy will only cover up to a certain amount of money. Just say it's $100,000. I'm just making a number up. Usually it's like $1 million, but usually there's a lifetime max. So if you're, if you've hit the exhaustion of benefits, that means there's no more benefits that can be paid, but you can probably appeal it and see where you can go with that. And then the other thing is, if your provider is out of network, you may not have out of network level of benefits. So, if you have, usually what I try to tell people is, try to steer, maximize your benefits, try to steer in network as much as possible. Lou just went through examples of that. But if you have to go out of network, you definitely want to determine what your reasonable customary charges are. And a lot of the times that you work with these carriers, you can go to the portals and you can put in like a CPT code, which is a medical code that you put in for that would be billed on a claim. And you can get that ahead of time. You could do a predetermination of benefits. You could do a prior authorization, but there's multiple ways of finding out ahead of time what your charges might be and what your out-of-pocket expenses might be. So one of the things I wanted to just maybe give an example on is, when you prior to filing your appeal, you definitely want to gather copies of your medical records, your explanation of benefits that you received in the mail. If you don't find it in the mail, like say you haven't gotten it and you need an EOB statement, we call it explanation of benefits an EOB. You can actually go to the insurance company's portal and download your copy of your data based on your data service. The provider, you can download a copy of your statement online. You want to definitely attach any information that the insurance company has sent you prior. You want to, make sure you involve your provider to make sure that you're determining whether or not there's a need to have medical necessity explained. And so while you may feel that, yes, I need this, this is for my health, your doctor should probably write a statement indicating the codes, the rationale behind the treatment, what your prognosis might be, and make sure you include all that information into your appeal. I want to give an example of a situation where somebody might have to appeal. Something that probably everybody encounters is going in for your annual physical. Your preventive care visit you're entitled to once a year for free. And usually within that, if you meet the age limit criteria, medical criteria, like say colonoscopy might come into play. So when you go to your doctor's office, you might say, hey doc, I'm here for my physical and, I definitely want to sign up, to get my colonoscopy. I'm 50 years old and I definitely want to get that out of the way. So that's great. That's usually covered 100% and you probably wouldn't have a problem, except when you go for your colonoscopy, you find out that you went, while you're under, your anesthesiologist is out of network, which is 99.9% of the time, that's the case. And usually with the colonoscopies, that's something that you have to pre-approve or get a prior authorization for. So just say you didn't do that, your claim would actually deny. And so you definitely want to make sure that you know your rights and make sure that have your documentation and say, okay, well, I went in because it was part of my annual physical, and here's a copy of my my doctor's office visit and the statement saying, where the issue might lie. If you don't, tell the doctor that, I've been feeling stomach pains and things like that. It might change the diagnosis code from a preventive care visit to a sick visit. And now, while you're in there for your annual physical and you're complaining about a stomach ache, and that, you're going to, need to sign up for your colonoscopy and want to see what's wrong, you just turn that routine visit, that free visit to a sick visit. So now you're going to get your colonoscopy. And then, when you get the claims come back, you're like, oh, what did I get hit with a, $5,000 charge? And that's because of, not going in for your annual physical and explaining that you're just there for your annual physical. Once you complain about something, the doctor has to make an assessment. And once he makes that assessment, that will cause that claim coding go from a routine physical to a sick visit. And now you have to appeal that. So it gets a little, complex with coding and place of service and the reason why you're getting a certain procedure. So I provided, here on this presentation, just a guideline. I'm not going through everything, but I just wanted to give you a high level view of what you need to do. So gather that documentation and make sure that you get your doctor to write a statement and write your own statement. Usually you get 2 level appeals. One is called an internal appeal. The other one's called an external appeal. And so we're going to go into how we file an internal appeal. So in the internal appeals process, you're going to complete all the forms with your health carrier. You're going to ask them, what is the appeals process? And this is usually outlined in your summary plan description or your certificate of coverage. And if you're not sure, call customer service. That's what they're there for. They're there to provide you, the ability to, appeal it and try to negotiate your bill. One of the things is when you submit these forms or any paperwork, it's very important that you put in your insurance coverage, so your carrier name, your name, the patient's name. So you could be the member, but the patient could be like your son or daughter. So you want to make sure you put the patient's name in as well, along with the member ID number, the claim number, and any documentation that's going to help get that claim reconsidered. What you're going to ask for is also is a clinical policy. So if it's something that's very complex, like outside of colonoscopy, that's pretty simple. But if you were going for, say, cancer treatment and something that's experimental, you definitely want to make sure you get the clinical policy on whatever treatment that you're getting, say chemotherapy, and making sure that you're matching the language from the contract to the appeal letter, so that way it can be considered. So another thing that you should be aware is if the coverage is silent on a benefit, it's usually covered. So not everything, unless there's a specific exclusion, that's also on your side. So if it's not specifically excluded, you can actually argue that point and get that claim reconsidered as a result. Make sure you file your appeal within 180 days, which is 6 months of receiving the explanation of benefits. And that's the claim denial. With the remark codes, it'll say the reason why it was denied. It usually takes about 30 days, whether it's a prior authorization, or if you're looking for medical services, like say surgery scheduled, an internal appeal can actually take about 30 days. If you need something that's urgent and you need immediate surgery, you can't wait any longer, you can ask for an urgent appeal. That usually takes no longer than 24 to 72 hours. You can also ask for a peer-to-peer review, which is, what your doctor meeting with the insurance carrier's medical director to talk it out. And, the next thing is an external appeal. So if you get a response back on the first appeal and they say, still, your claim is denied, or we cannot consider because there was insufficient information, you have a second level, and the external appeal will give you the opportunity to ask for an outside party to be like an independent assessor of the claim. And you're still going to get your documentation together. You're going to put your name, member ID, all the pertinent information on every page. One of the reasons why I've mentioned that is because they scan all this paperwork through their systems electronically. And should the paperwork be separated for any reason, the systems will automatically pick it up based on your name and ID, and they'll match the records together. So if sometimes people will say, I sent it 3 times to customer service and they never got it. It might be because not every page was identified with the member name, member ID, and the claim in question. So, things get skewed sometimes. So when you go for the external review, you definitely want to make sure that you understand the reason for denial, and what you're asking for is, again, matching the contract language to the appeal, to the reason why it was denied, and asking for a reconsideration. Prior to filing your appeal, you have the ability to also go to, I provided a state list here. I'm not going to click on it right now, but there's a state list where if you can't find your EOB, or if you can't find your final denial, you can actually go to the state list and find your state, and you can actually contact the office there for assistance to help you acquire that. All insurance companies are required to provide you an external level of review free of charge. And you definitely want somebody like your doctor or your provider to provide you a letter or a statement of your situation with the medical codes and all the pertinent information for it to be considered and overturned. For external appeals, it takes about 60 days for you to get a response. And if you don't get a response within 60 days, that can actually get escalated and reported to the state. So you definitely want to make sure you keep an eye on timing. And what you'll normally get is, either the carrier will uphold their decision, or they'll let you know that they decided in your favor and they approve your claim. If this ended up being a prior authorization, you definitely want to make sure that includes the correct dates in there, the date ranges for the approval. If it's medication, you definitely want to make sure that, if they're approving for 30 days, it says 30 days. If they're approving for a 90-day supply, then it's 90 days. And, if it's an approval for, something more serious, like some sort of chemo treatment or something, 6 months to a year, you definitely want to make sure the dates are correct on your decision. If it's not, that's something that you definitely need to call customer service back on and let them know they made an error. So that's essentially, the presentation in a nutshell. The process can be very complex. I'm here as a patient safety advocate first. I can provide support and guidance if anyone is out there that needs help with negotiating bills or trying to understand how to file an appeal or need help with wording an appeal. I am available.